Welcome to Yes, It Happens, RSV illness in adults. I'm Sarah McQueen. I'm a physician assistant with Dayspring Health, and I do family medicine.
And I'm Justin Ortiz. I'm a pulmonary and critical care physician at the University of Maryland.
And so we're just chatting here today, and we want to go over several different things about RSV illness in adults. Some of that is we want to talk about the mechanism. We want to talk about the overall incidence. How often does it happen? We want to talk about the impact, both in our healthcare system and in individuals as they struggle with RSV. And then we also want to talk about, I think, the most important thing, which is prevention. So, Dr. Ortiz, would you provide us a little bit of historical context of RSV? Why are we just now hearing about it? Is this new?
Yeah, well, no, it's a great question, and of course not. The answer is no. RSV has been around for a very long time, and frankly, every wintertime, numerous respiratory viruses circulate and cause disease in people. For the longest time, we only cared about influenza for the specific reason that only influenza had treatments and vaccines. The influenza virus was discovered in the 1930s. Influenza vaccine was developed in the 1940s. And ever since then, there has been a great deal of public health interest in monitoring influenza circulation worldwide. And the main reason for this is because influenza and knowledge of influenza circulation really mattered. In the 1970s, there were specific influenza treatments that were made available, and so knowing if influenza was in your community was important because a fever, cough, and a sore throat could very well be due to influenza, which is treatable. Also, given that influenza vaccines were available, knowledge of circulation of influenza helped us to understand the best time to deliver vaccines in pre-seasonal campaigns. Uh, Numerous other respiratory viruses also circulate, but they're less interesting medically because, well, frankly, we haven't had treatments and we haven't had preventive interventions such as vaccines. Uh, but Certainly, beginning around the year 2000, there has been slow adoption of better diagnostic tests in hospitals, in public health laboratories. These diagnostic tests identify not just influenza, but other respiratory viruses which are circulating, and there are many. And it is with the widespread adoption of the better diagnostic tests that we've begun to realize that, oh my goodness, there's a lot more than just flu circulating, and there's a lot more than just flu that's causing illness in older adults. Since the 2019 coronavirus pandemic, the COVID-19 pandemic, we now have another respiratory virus which circulates that has a specific vaccine and specific treatment. And so now, after the coronavirus pandemic, we have a particular interest in knowing not just when flu is circulating and who has the flu, but also when COVID-19 is circulating, who has COVID-19, because, well, they have prevention and they have treatments available. This has changed, though, in the last couple of years with the introduction and licensure of RSV vaccines for older adults. Now, we know that RSV circulates with all those other respiratory viruses every winter, but it wasn't until the widespread adoption of better diagnostic tests that we began to realize that, oh my, RSV is a major contributor to disease and even death in our patients. With this increased recognition of the RSV's importance came a great deal of interest in vaccine development. And recently, RSV vaccines have become available and are now recommended by the CDC for the prevention of acute respiratory infections due to RSV. And so in this short amount of time, in the course of my career, we've gone from only caring about flu to now recognizing that there's many different respiratory viruses circulating. Many of them contribute to the illness of our patients, and three of them have vaccines which work well and can protect our patients from illness.
Excellent. I love how you just described, it's kind of a cycle. You see something, but you don't know what it is, and so there's research put into it. We increase our testing capabilities. We find it, we name it, and then it cycles on to getting prevention and these vaccines.
But I think that what this also means is that most people my age and older have grown up recognizing that flu and influenza is important, but you have less knowledge of or recognition of these other respiratory viruses that circulate. I mean, certainly, COVID-19 is an exception, but because we haven't been looking for RSV, because we haven't been looking for any number of other respiratory infections, para-influenza, human metapneumovirus, because we haven't been looking for these, that they don't have the recognition within the public as important pathogens, important causes of illness. And because of this, I think that there is a challenge right now to uh, try to inform the public that RSV prevention is important. And frankly, there are many healthcare providers out there who have limited experience with RSV. And it is important that when patients come to them and ask about RSV prevention, that they have the knowledge and the experience with RSV vaccines to be able to share this decision making with their patients, to share with them what their risks are, what the potential benefits of vaccines are, and what the potential risks of choosing not to vaccinate are.
Absolutely. What is the population that is the most at risk for RSV in these adults?
Well, I think the key thing you said is in these adults, because I think for a very long time it's been recognized that RSV is a major contributor to lower respiratory tract illness in kids. In the United States right now, RSV is the number one cause of lower respiratory tract infection in kids, and pediatricians and healthcare providers who care for kids have been, I think, in tune to this for a very long time, and there are certain treatments or certain preventive interventions that have been available to kids that aren't available to other groups. But with the widespread use of better diagnostics, we're learning that adults are at risk. And you're right that there are some adults who are at greatest risk, and those at the greatest risk are those who are older, generally older than 60, although the risk rises with age. But even those under 60 who have certain chronic medical conditions, chronic heart conditions, chronic lung conditions, diabetes, kidney disease, all of those individuals are also at increased risk. And frankly, for people who are familiar with flu, most if not all of the high-risk conditions for severe flu are also the high-risk conditions for severe RSV illness. There's another group, and I know that it's a group that's of particular interest to you, which is individuals living in skilled nursing facilities and nursing homes. That it is clear that many of them have comorbid conditions, but also I think that the other factors related to being in a nursing home, deconditioning, having frailty, as well as having many people kind of packed in one facility where one person with an infection could lead to many people with an infection, is also increased risk. And at present, the vaccine recommendations are targeting those who are at risk because of age, 60 years and older. But if we look down the path a little bit, we'll see that CDC is already considering whether risk-based recommendations may be the best way going forward as more vaccines become available. And so I think that we could anticipate that within the next year, CDC may go back to the drawing board and they may identify individuals over 60 who have the greatest risk, and they may also identify individuals younger than 60 who are at increased risk for tailor-made vaccine recommendations. But at present, the CDC is pretty firm in their recommendation that persons who are 60 years and older should sit down with their healthcare provider and discuss together risks and benefits and share the clinical decision about whether they should be vaccinated.
Absolutely. And you brought up that I do have experience with nursing home, long-term care facilities, and that is a huge place that needs RSV vaccination along with the other vaccinations that we give adults. And it is because just like you said, they're in close living quarters, but also those tend to be the sickest of our adult populations, and so just a little experience that I had. I had a patient specifically. I saw them after a COVID-19 infection, and they were shocked that they were like, I didn't even know I was sick, and now I had to. It was in the time of the 10-day isolation. They were upset. They missed out on the cafeteria. They missed out on the lifting weights. And so when I got to see them, I said, "Hey, welcome back to bingo and other lame things in the cafeteria." And they were like, "Oh, I know. I didn't know I was going to do all that." And then a few months later, this same person, I get a report, that they had to go to the ER because they were very sick, hypoxic, and things like that. And it turned out they had RSV. They didn't have to stay in the hospital, thank goodness. They came back to the facility with some oxygen, and with some albuterol nebs and things like that because we don't really have a good treatment. So you're really just offering supportive care. And they were like, I didn't even think I could get RSV, but this is the sickest that I've been in my life. And so kind of walking through that and hearing somebody else, our patients don't know that they can get it. Our patients don't know that they're at risk.
So I have a question for you. Have you noticed that your patients, maybe my age or older, have no idea what RSV is? What has been their recognition of RSV as an important contributor to disease, uh, especially since not too long ago, RSV was probably unheard of by most of our patients.
Absolutely. It is a big issue. It's a big problem. The general population, we do, I think all, even clinicians, we think of it as a childhood disease, and we don't think of the impact of our older folks. Sometimes though, it's tricky to be in a clinical setting where you're also trying to be, good stewards of cost of healthcare, and also to patients who have to pay for these tests if their insurance doesn't cover all of it, or they have large copays, or what be it. If you're going to order a test that doesn't necessarily change or doesn't at all change your treatment plan, that's a difficult thing to talk about, and to encourage your patients to do. And I think that's something as clinicians we're going to even wrestle with. Of we want to know what's out there. We want to know how prevalent it is in our own community. Because one thing is, when different pandemics, we know that flu kind of hits areas at different times. And so is that the case with RSV? Well, we don't really know that yet, and so knowing when it's in the community is a good thing. But then it's difficult if they're going to have to pay for that test, because these PCR tests are very expensive, sometimes $300-400, and so that's just something as clinicians that we struggle with. But then on the other hand, too, there's lots of hands apparently. It's one of those things where if you're struggling with viral illness versus bacterial illness, if you can confidently say you are positive for RSV, that's going to help with our antibiotic stewardship as well. And so there are benefits, even though it doesn't change the treatment plan. Knowing the overall health of our community, knowing that we don't have to use antibiotics, I think those are other benefits to increasing our testing and capacities if we can.
Well, I'm absolutely in favor of public health doing surveillance for RSV and sharing their findings, letting us know when RSV is in our community, letting us know that RSV is impacting the community by causing respiratory infections leading to outpatient visits or hospital visits. I think that it's important for public health to also, through their messaging, let us know whether RSV is causing deaths, both within our communities and nationally. And so, in order to do that, you need to do some sort of testing. The problem comes at the point of care. Often we have combo tests, which will tell us flu, COVID, and RSV. And if somebody has flu, then well, you can treat it, right? If somebody has COVID, well, you could treat that. It's a lot harder, with that RSV, you don't know what to do with it. And you can say that, well, individuals who test positive for RSV should be quarantined, should follow respiratory precautions, should wash their hands. You should isolate them from high risk individuals. But frankly, you should do that with any acute respiratory infection. And so, at least in my practice, knowledge of RSV at the bedside isn't particularly helpful. But I could see how, from a public health perspective, knowledge of the burden and the activity of RSV in the community is really important to get the word out, but also I think to encourage appropriate behaviors around, staying home from work when you have a fever and a cough, or keeping your kids home. So it's a tough one. If we don't do a lot of testing, we're not going to recognize a lot of RSV. But without a specific treatment, there's not a compelling reason to do a lot of testing at the point of care.
Absolutely. And I almost think, the spread of the knowledge of RSV in adults is probably going to happen the most word of mouth. I mean, I think that's really where most people get their information. It's down at the senior citizens or the club meeting, or around the lunch table at work. It's, man, I just came back because I had RSV. What? I didn't know you could. And so I think the more we test and other people can experience and know that they've experienced RSV, it is going to get out there that adults get RSV. And so then perhaps they're going to pay more attention to the RSV vaccine signs at their pharmacies, or when we, come in and we're doing our PQRI and doing a really good job about prevention, they're going to listen to us a little bit more because they've heard other people around them that have had it. And so I do see the benefits that, as far as a public health standpoint and prevention, that testing has.
Yeah, and certainly, I think that people aren't willing to go through a lot of effort to prevent the sniffles, but RSV can cause serious illness, particularly in your patients. How bad can RSV be?
I think the short answer is it can be really bad. RSV is one of those viruses that you actually have some epithelial cell sloughing, and so not only is it increased mucus, but there's actual debris that gets in your lungs, and so my patient population. We have a really high population of COPD. We have black lung. We have folks that probably have black lung but haven't been diagnosed formally yet due to all the regulations, and we have smokers, and so their cilia already is not functioning, and so you have all of these risk factors, and then you add a virus on top of that that's going to increase mucus, it's going to increase that sloughing. You're really getting yourself into a dangerous situation. We have a lot of asthma. We have folks with a lot of, so the in where we are in the southeast, allergies are terrible. Okay, and so you have this propensity for this reactive airway disease, and then you add this virus on top of that, and so it can be a really tough situation. And so we do see anywhere from 10 to 15,000 deaths a year from RSV in our adults over 60. And so I think that is something to keep in mind, where the most of infections occur in kids, but the most deaths occur in our elderly population. And so it is a serious illness. And I think and so I think it's good that it's finally getting recognition. And these are things we used to just call COPD exacerbation, or a respiratory failure. We don't know. And so now we have a name to it, and I think it's good.
Yeah, no, I think that worsening things that patients already have is a very common consequence of a respiratory virus infection, maybe one that's not appreciated. As you said, the COPD exacerbation is seen as something that happens randomly, and that may be the case, but it can also happen in the setting of a respiratory virus infection. And wouldn't that be nice if it could be prevented, right?
So now that we have vaccines, how in the world are we going to get people to use them?
Well, I mean, that's the challenge, right? There's limited recognition of RSV as an illness. There's certainly a lot of fatigue when it comes to vaccines right now, just coming out of a pandemic with all of the push to get people vaccinated with COVID-19. But but the truth is that we think that RSV vaccines could have a major impact on people's health and well-being as well as public health. Um, in the last couple of years, we have seen a real kind of landmark studies on RSV prevention. Not only do we have two very good vaccines that are now available for use in older adults, they are safe, they work very well. They have, I think, just changed the landscape when it comes to adult immunization and prevention. I think that we need to work together to increase recognition of these vaccines. We need to work with healthcare providers to ensure that they are offering them and that healthcare providers feel comfortable discussing the risks and benefits of vaccination with their patients. And I think it will take time, but the RSV vaccines that we have available to us now are safe. They're as safe as flu vaccines, which have been given since the 1940s and have a very strong safety record. The pain and swelling from the RSV vaccines is comparable to what we see with flu vaccines, and I get my flu vaccine every year, they're the benefits of the RSV vaccines is you probably don't need it every year, and so unlike a flu vaccine, which once you get started, it's something that you could consider an annual decision. With RSV vaccines, while the evidence is not completely out right now, but the recommendations are not that we need the RSV vaccination every year. I think that this will help. I think that slowly, with increased recognition, with increased recommendations by healthcare providers, and the opportunity to discuss, whether vaccination is what you want is really important, and that's where we are in the stage of this uh, public health intervention. Is we have a vaccine, but vaccines do absolutely nothing unless they're in the patients. And so you and I and all of our colleagues need to ensure that we are recommending RSV vaccines to people who for whom they're licensed and for whom they're recommended. And we need to listen to their concerns when they have questions.
Absolutely. And I think I always like to take a little bit of a targeted approach in the beginning with newer vaccines and because to just blanket and go hard after everyone, that feels really overwhelming when you're talking about colonoscopies and optometry visits and all those at the same time. And so really focusing on our patients who are at risk, like we've talked about with the already having lung disease and heart disease and things like that, but then also who's at risk because they're around others that have RSV. And so that's going to be folks that have young grandkids in their family. It's going to be folks who work at daycares. It's going to be our folks in our long-term care facilities. And so really, it's similar to how ACIP recommendations for Tdap. If you're an adult, not everyone's supposed to have an updated one of those as an adult, but if you were around or you're going to have a newborn infant in the house, that was kind of a talking point that you could discuss with your provider of if you wanted to get an updated Tdap just to help with pertussis. And so having those conversations of, oh, you're going to have a new grandbaby. Let's talk about this vaccine and your risk factors and see what you think about it. And I like a more targeted approach to recommending that. Folks that go to church or any big civic event where there's kids around and kids are touching the offering plates, and so everybody's touching the same thing that the kids are touching. They're like, this is really important because all of those germs are spreading, and so just thinking about that, and then also in our area, a lot of our a lot of our grandparents are actually parents. With the opioid epidemic, we have a large portion of grandparents being parents, and so they're the ones going to the schools, delivering snacks. They're the ones going on the field trips with their kids. They're around their kids, and so those folks are at risk because they're around their grandkids all the time. They're in the home, and so thinking about those situations is also really important. I think of those are who I'm going to start with, and who I talk with the most are the ones that are around the young kids.
Well, studies have shown, I mean, time and time again, that one of the best ways to encourage a patient to be vaccinated is for a healthcare provider to recommend it, right? It's not just you and me, but it's the medical assistants collecting the vitals. It's the person at the front desk taking the intake. If we recommend the vaccine, our patients are more likely to accept it. Of course, if we don't recommend a vaccine, then it's highly unlikely our patients will accept it. And so ensuring that there are systems in place that we at least mention it. There are some guidelines that suggest that you look up whether your patients are up to date in their vaccinations every time, and if they're not, to recommend it. I agree with you that you have to pick and choose your battles, and that there are some people who are just adamant. But even those adamant patients, if you recommended it, they'll say, if that's what you say is best, I'll do it. Uh, how hard you recommend, of course, depends a little on risks and your need to maintain your therapeutic relationship. But I think that recommending vaccine uh, at every visit, for those patients who aren't up to date, is helpful. How hard you recommend, depends on a lot of things. But patients are unlikely to be vaccinated if it's not offered, for sure.
Absolutely.
I, you've already shared some of your ideas, but you have a lot more interaction in outpatient clinics than I do. What is your approach? I mean, how can you convince people to get vaccinated?
So I think the main thing is stressing. We had a lot of strange information. There was misinformation with the COVID vaccines and the pandemic, but there was also just a lot of public health tends to have language that they use that's different than clinical health, and then that's even different than how we speak to our patients. And so much of it was just confusing, and it was the wording, and it was new information coming along. And so really I just try to sit down and I say, listen, I can't promise you this vaccine is going to keep you from getting RSV. In fact, you more than likely you will still get infected with RSV. However, what I can tell you is that this vaccine is going to decrease the severity of the symptoms that you're going to have, the even it's symptoms overall. You may have a totally asymptomatic case of RSV. We don't know all of those things yet, but it's definitely going to increase the severity. It's going to, or decrease the severity. It's going to decrease the amount of time that you stay sick. So then you're back to your normal life sooner. You're back around your family and your friends sooner. And so I can't promise you that you're not going to get sick, but this is your best chance of not ending up really sick, not ending up in the hospital. Hopefully, it's going to prevent death. That's what we design these vaccines to do, is we're trying to prevent death and severe illness, and they do a great job at that. And so I really try to stress, look, our goal is not to keep you from getting sick. Our goal is to keep you from getting really sick or too sick to the point that we can't stop it, and that we can't bring you back. And so that is what I always try to stress, and I think for a lot of people that makes sense.
I always share not only my professional recommendation to patients, but I also tell them what I advise my parents to do. Sometimes I think that they feel that we have some distance between us and our patients, but everybody loves their parents, and I think that if they hear that I would recommend it to my mother, who's their same age, who has similar medical conditions. I think that that means something that resonates. I also share that I get vaccinated uh, with the hope that that might demystify the process. But I agree with you. We grow to love our patients, and we don't want them to get sick. We don't want them to suffer, and so it's kind of a part of the therapeutic relationship, but just our friendship that we have with our patients. We really want them to do the best that they can to keep and maintain their health.
Absolutely. That's correct.
Uh, Sarah, I've enjoyed talking with you. As we wrap up, are there any key points that you think you would like to make from our chat?
I think the biggest takeaway is that RSV is common and it may be really severe in our older adults, and especially those with specific conditions. And I think it's also, it looks like other respiratory illnesses that we deal with, such as the common cold, influenza, and COVID-19. And so I think we all need to be on the lookout for this in our older patients. And I have absolutely enjoyed talking with you too. What about you? What are your points that you want to bring up?
Well, I think that unlike flu and COVID-19, there are no treatments for RSV. The only way we can not get RSV is to prevent it with vaccination, and we're very lucky that within the last couple of years there have been two safe, efficacious vaccines which have been licensed and recommended for use. They are targeting adults older than 60 years of age. And we would recommend that our patients talk to their healthcare providers, have a discussion about whether they should receive the RSV vaccine, and we encourage healthcare providers to encourage similar discussions.
Dr. Ortiz, it was a pleasure speaking with you, and I thank you, and I thank everyone listening. And my hope is that this becomes something that we're all addressing in our practice and in our lives, and hopefully you've learned something in our discussion today.